Hi there, I'm the neuromuscular mechanic, and today we're going to talk about how to use neuromuscular electrical stimulation to improve muscle spasticity. So first of all, what is spasticity? So spasticity is a condition characterized by increased muscle tone and stiffness. And that stiffness makes it challenging to use the muscle strength that you might have, and it may also cause abnormal positioning. And it's something that your healthcare provider can detect on examination, often by stretching of the muscles. And we only see spasticity with injury to the central nervous system, meaning the brain, brainstem, or spinal cord. And this is important to recognize because not all muscle spasms are muscle spasticity. So if you believe you're suffering from muscle spasticity and this is interfering with your function, you should talk to your healthcare provider. So how does it work? So again, it stands for neuromuscular electrical stimulation. Other terms you might read about on the internet that are similar include EMS or electrical muscle stimulation or functional electrical stimulation. And the idea is that you're using the electrical stimulation, applying it across the skin to activate nerve fibers to get a muscle contraction or muscle movement. And this is different than TENS, which is the application of electrical stimulation to activate sensory nerve fibers. Now that has evidence for spasticity. We're not going to talk about it today, and I talk about it in another video. So when we talk about electrical muscle stimulation, well, how does it work? Well, one of the ways it works is what we call reciprocal inhibition. Now this is a sort of challenging concept, but if you think of a joint, like the elbow joint, there's two sets of muscles. You can think of one as the agonist muscle group and the opposing group as the antagonistic muscle group. So for the elbow joint, we know that there's a group of muscles in front of the elbow called the elbow flexors that bend the elbow. We could call these the agonists. And then on the opposite side are a group of muscles that straighten the elbow or extend the elbow. And we could call these the antagonistic muscles. And if you think about it, like in this picture, if somebody's trying to bend their elbow, they need to at the same time activate the elbow flexors or elbow benders, while at the same time relaxing those muscles that control elbow extension or straightening of the elbow. Now this naturally occurs. There's sort of these reflex arcs that happen at the spinal cord. So when a muscle that controls elbow flexion, like the biceps, is activated, signals are sent to the spinal cord to relax those muscles that extend the elbow, like the triceps, so that you're able to bend the elbow effectively. And what we do with electrical muscle stimulation is we take advantage of that principle of reciprocal inhibition. So using, again, this picture here on the right as an example, if you had somebody who had a lot of elbow flexor tone to muscles like the biceps or the brachialis and their elbow was bent, what we could do is apply the electrical muscle stimulation to the back of the arm over the triceps. And what that would do is by activating the triceps to get a muscle movement, it would send signals through the spinal cord to relax the biceps, to relax the brachialis, and to reduce that elbow flexor tone. And so that is how this works. Now, the other way that it's been studied is in the application after botulinum toxin. So botulinum toxin is an injection that physicians will put into spastic muscles to help relax them. And so people have studied using electrical muscle stimulation over those spastic muscles that were injected, and there's some thought that it may increase the uptake of the toxin and improve sort of the clinical benefit. And that's often best done sort of within the same day of toxin administration. So those are the two ways it can be used. If we look at what the research says, so again, that idea of using it with botulinum toxin, this is on the left here, the left box, there's this systematic review from a group in Italy that looks at this. And then if we look at that idea of reciprocal inhibition, using it over antagonistic muscles to relax spastic agonist muscles, there's evidence both in spinal cord injury and stroke in these large systematic reviews for improving both spasticity as well as range of motion. So it is an evidence-based treatment. Other benefits of using electrical muscle stimulation is that you can combine it with other treatments for spasticity. So as mentioned, you can combine it with botulinum toxin. You can combine it with medications like baclofen or bracing or physiotherapy, and it's often more effective when it's done this way. It's well tolerated. There's non-spasticity benefits, so it can minimize muscle atrophy from disuse. It can be used to protect skin health and protect against pressure ulcers. And in those that do have a little bit of sort of voluntary movement, if you combine electrical stimulation at the same time as an individual tries to move their limb, it might actually sort of promote and strengthen those pathways that could lead to better voluntary control. And the other benefit is that this is a relatively affordable treatment for individuals. So these devices can be purchased online. The one that I got in Canada through Amazon.ca is about $80. And so quite affordable, and can also be delivered and used by a patient directly. So once you're sort of educated about its use by a healthcare provider, it's something that you can do at home by yourself or with a loved one helping. And so there's several benefits. So how can you get started? So again, discuss with your health professional, find out if it's the right thing for you. Ideally, those electrode pads should be placed over the antagonistic muscle, so the muscle opposite to those that are spastic, to take advantage of that principle of reciprocal inhibition. The only exception would be if you're using it immediately after the administration of botulinum toxin, where in that case you'd want to put the electrode pads over the spastic muscles. And in both cases, the goal is to deliver sufficient stimulation to get a muscle movement or contraction. So in this slide here, I just have shown some setups for some common muscles that you could target with EMS. So on the top left there, I have the electrode pads. They're generally spaced a couple centimeters, an inch apart, but in this case, they're over the deltoid. So the deltoid controls shoulder abduction, so bringing the arm up and to the side. And so by applying it over the deltoid, that may be beneficial for minimizing tone and spasticity to the shoulder adductors or internal rotators like the pectoralis group. And in that situation, often the arm is sort of held in by the side. Just to the right of that, I have the electrode pad set up over the back of the forearm. This is over the muscles that control wrist and finger extension, so bending the wrist and fingers back. And this application may be beneficial for those individuals who have spasticity to the wrist and finger flexors, where the wrist is bent down and the fingers are curled up. And then in the bottom left, I have the electrode pad sort of over the triceps muscle, which is responsible for extending or straightening the elbow. This may be beneficial for relaxing elbow flexor tone where the elbow is bent. And then to the right, I have the electrode pads placed over the anterior and lateral compartment of the leg. So these are over the muscles that control bending of the foot upwards. And this can be beneficial for those who have spasticity to the back of the calf, to the ankle plantar flexors that may draw the ankle down, may make it difficult to clear the foot while walking. So how can you get started? Again, there are certain parameters that you can program on your device. What you'll find across many studies is that there's many different parameters that are used. And that variation exists because everybody has slightly different parameters to optimally activate their muscles, and that can be across different muscles in the same individual. And so these parameters that are commonly used, the first one is called frequency. This is how often you're providing a stimulation. So in hertz, often you're providing something between 20 to 50 hertz. There's what's called the pulse width or duration. This is how wide the shock is, usually between 0.1 to 0.5 milliseconds. The intensity is how strong the current is. This is measured in milliamps or little m big A. Generally, most machines will be sort of 100 milliamps or less. And ideally, you should do this for 30 minutes a session, 3 to 5 sessions a week. I would recommend doing a 4-week trial and then evaluating afterwards what the benefits are and if it is beneficial, continuing. The other parameter just to mention is that some machines have what are called a ramp time, and the ramp time is set to control the smoothness of movement. So I've tried to illustrate this here on the figure in the right, and so intensity is sort of on the y-axis and time in seconds is on the x-axis. And so what happens is if you have a ramp time, there's this ramp on period where you go from no intensity to the program intensity sort of slowly. And that can sort of be changed. It might happen in 1 second. It might happen in 2 seconds. You can program that. And then there's often a ramp off time where, again, you program from that maximal intensity that you've programmed to being completely off, and you can modulate that as well. And so when you get started, again, there's ranges to the frequency, pulse width, and intensity. And then in this table, I've sort of put what you might notice if you're at the upper range of those frequency, pulse widths, or intensities, and what you might notice at the lower range. And again, the goal is to get an effective, strong contraction, but also be comfortable. So with the frequency, if you're at the upper range, 50 hertz, you often get a smoother contraction. It's actually more comfortable. However, it can be fatiguing for your muscles. Whereas if you're more at the lower range, 10, 20 hertz, the contraction is often jerkier, it's less comfortable, but it's less fatiguing. The pulse width, if you're at that upper range, more around 0.5 milliseconds, you get a stronger contraction. It may spread to other muscles depending on what you're doing. If you're doing a smaller muscle, you might get spread, which might not be ideal, and it can be less comfortable. The lower range, you can get a weaker contraction, but it can be more comfortable and less spread to other muscles. And then the intensity, the upper range, as you get closer to 70, 80, 90, you can get a stronger contraction, but less comfortable. Whereas if you're lower, you can get a weaker contraction, but more comfortable. So again, depending on what muscle you're targeting and what your muscles are like, there's going to be variation in the optimum frequency, pulse width, and intensity to get the best contraction that you can tolerate. And so I just wanted to show here in this last video an EMS setup that I did on myself over the wrist and finger extensors. And so I have this set at a frequency of 50 hertz, a pulse width of 300 microseconds or 0.3 milliseconds, an intensity of 45 milliamps, and then a ramp time on of 2 seconds, a total time for each stimulation of 5 seconds, and then a ramp off of 2 seconds. So I'll just play it here to show you. See, as you see, it goes on there, period off, and then shortly here it'll go again. There I go on, and then off. So again, it's on for a total of 5 seconds, and there's a little bit of break. And again, I've set the ramp time on, and then the off time is both 2 seconds to get that smooth sort of contraction. If I did it, say 1 second, it would be a little jerkier. So again, you can play around with the ramp time to get a smoother contraction. If I had a weakened ability to sort of bring my wrist and fingers back myself, then what I could do is when this stimulation is coming on, which I can sort of get a sense of after I do a couple, then you can actually try to voluntarily activate those muscles right at the same time that you're getting the shock. And by pairing these two together, there can be improvement sort of in the rewiring of those sort of neural pathways to improve voluntary control. So this is something that you can use potentially to get some additional benefits beyond spasticity. Now, certainly there are some individuals who should not use any neuromuscular electrical stimulation. So you should speak to your healthcare provider if you have a history of seizures, are pregnant, or planning to become pregnant, or if you have implanted devices like a pacemaker where the electrical stimulation may interfere with the device. Other situations where you may need to be cautious or talk with your healthcare provider include areas of open skin. And so to summarize, neuromuscular electrical stimulation can be beneficial for spasticity. The whole goal is to elicit muscle contraction, very different from TENS. And it takes advantage of that idea of reciprocal inhibition, so applying it to antagonistic muscles to relax agonist muscles. The one exception is that if you're using it immediately after the administration of botulinum toxin, you can apply it to those muscles that were spastic and injected. And there is a wide variation of stimulation parameters that can be used, again, frequency, pulse width, intensity, and the ramp time. And these are adjusted to influence both comfort and contractility. If you have any questions, please post them in the comment box. I'm the neuromuscular mechanic, and I hope you found today's episode handy.